Stopcocks are utilized in the ICU in a variety of ways. It's important to understand how to turn this dial to the direction of what you need in order to do what you need to do, essentially. You'll see these connected to transducers for A-lines, EVDs, Swan-Ganz catheters, and also Lopez valves are also a form of a stopcock. You can see that the dial says off on it right there, and that's essentially what it does. Whatever that dial is turned towards is what is going to be off. An easy way to remember that is to think of it as a roadblock. So nothing can get through that roadblock. You can't go forward, you can't go backwards, and that's exactly what it does. So in this position, we are off to the top, meaning if I go to push this plunger down, it is not going anywhere because there is a roadblock there. The stopcock is turned off to the top. However, if I turn it off to my simulated patient, which is on the left side over here, you can see that now the fluid can move freely from the top to the right. I can push it and it fills up the syringe on the right side. I can use the right-sided syringe to fill up the top, and so on and so forth. I can also pull back on the top to withdraw fluid from the right side. So again, this would mean that the stopcock is turned off to the simulated patient on the left, and fluid is able to move freely between the other two. Now in this position, the stopcock is turned off to the top. So fluid is now able to move from the left to the right freely. I can pull back on the syringe on the right side and pull back blood, which really is just hot sauce for visual effect, of my simulated patient on the left. You can see it freely moves. Now if I turn it off to the right, what do you think would happen? Yep, roadblock right there. Nothing can move past that because it's off to the right. However, blood can move freely, or hot sauce can move freely from the top and the left in this position. And that's exactly how you would communicate that. You would say it's off to whatever. So like zeroing an A-line, you say off to the patient, which means that you would turn the stopcock off to the patient in order to zero the A-line on the monitor. Once you do it a few times, like in person, it does make sense, but hopefully this little visual helped you kind of see how to manipulate this little dial to get it to do what you want it to do. Remember, off is essentially a roadblock. Hopefully that was helpful. Let me know in the comments.